Look closely at this practice. Hijama is an ancient, highly delicate therapy. For the practitioner, placing these cups requires absolute focus and a deep connection to the patient's well-being. But step outside the treatment room, and the reality of running a clinic often looks more like this: stacks of physical patient files, scattered appointment books, and the constant stress of tracking down a medical history hidden somewhere in a sea of paper. Then comes the financial side. Calculating daily revenue and figuring out the exact commission splits between the clinic owner and individual therapists usually involves hunched shoulders, manual tallying, and inevitable human error. Hijama clinics also face a unique logistical hurdle. Because treatments are closely tied to the Islamic lunar calendar, specifically the 17th, 19th, and 21st days of the month known as sunnah dates, clinics experience sudden, intense rushes of patients that are incredibly difficult to prepare for manually. A healer's primary job is to focus entirely on their patient's recovery. They shouldn't be forced to navigate a maze of administrative guesswork. This is exactly why the Hijama management system was created. It serves as a digital bridge to automate the chaos, letting practitioners return their full attention to the art of healing. Let's look at this main dashboard to see how it works in practice. We'll follow a test patient named Ikram as he arrives at the front desk. Right away, the staff is greeted by a clean, modern digital environment. Notice the calendar section here. The system actively tracks the Islamic lunar cycle in real time. It automatically generates alerts for upcoming sunnah dates, highlighting the 17th, 19th, and 21st, so the clinic knows exactly when to expect a surge in bookings, including Ikram's. Once Ikram is logged into the system, his progress is tracked visually through these funnel circles. At a glance, staff can see exactly how many patients are booked, completed, or have paid. When Ikram moves into the treatment room, the physical paperwork is entirely eliminated. His therapist simply opens his secure, comprehensive digital profile on a screen. Using this 2D anatomical map, the therapist digitally pinpoints exactly where wet cupping was applied. Simultaneously, the right side displays his blood pressure, temperature, weight, and notes. His entire medical context is immediately available. Recording the physical treatment digitally removes the risk of misreading old handwriting or losing files. When patients see their history managed with this level of precision, their trust in the clinic's professionalism deepens. After the session concludes, Ikram pays his fee at the front desk. This is when the software's invisible administrative features take over. When payment is entered, the system instantly splits revenue. For a 60-40 agreement, exact amounts are assigned automatically. Scrolling down reveals an itemized ledger of past sessions, completely eliminating end-of-month disputes and manual math. As the financial ledger updates, the software simultaneously synchronizes the clinic's inventory with the treatment performed. To prevent critical stockouts, it includes a proactive failsafe. These low stock alert rings turn red the moment a supply drops below a safe threshold, like here where the system is flagging that the supply of clinical gloves is running low. Crucially, this entire complex backend can be toggled between English and beautiful Urdu Nastaliq script with a single click, ensuring every staff member can operate it comfortably. These automated systems effectively replace hours of daily, tedious management with instantaneous digital precision. Now, let's step back and look at the clinic for Elite Honors perspective at the end of the month. This chart compares daily revenue against total sessions over time. The software takes all those raw, individual inputs and transforms them into clear visual trends, showing whether the business is growing or shrinking. And by looking at these demographic visualizers, specifically the age trend chart on the left and the gender breakdown ring on the right, the owner can instantly understand the exact profile of their core patient base. Having this level of data at your fingertips replaces the guesswork and estimations that often stall the growth of traditional clinics. When administrative tasks are organized and math is automated, the owner can pivot their attention from searching for files toward opening new locations and spending more quality time with each patient. It is time to leave the archaic paper methods behind. Upgrading your workflow with Hakim Syed Abdul Wahab Shah's Hijama management system is the surest way to secure your clinic's success in the digital age.